Hello, I'm Dr. Teymoorian. A lot of people have difficulty taking eye drops, and there's a right way and many wrong ways to do this. This video will teach you the right way to take eye drops and give some tips for people who have a hard time doing so. First, when should you take your eye drops? If you're supposed to take more than one type of eye drop at the same time, separate them by 5 minutes or so. This lets the first eye drop absorb before it washes out by the second one. Most eye drops come in bottles that have a screw on the cap. Once you unscrew it, you need to be careful not to touch anything to either the inside of the cap or the tip of the bottle because these areas are sterile. Any bacteria that gets onto those surfaces can grow in the bottle and contaminate the drops. Some eye drops come in a little vial like this where you twist off the cap. They're usually drops that have no preservatives and they're designed for you to take as a single drop and then throw the whole thing away. Without preservatives, there's nothing to keep the bacteria and fungus from growing inside the bottle, so manufacturers make them single use. Throwing the vial away is always recommended and approved by the FDA, but to save money, some people try to use these droppers more than once. If you're going to do that, here's what I would recommend. Keep the tip of the vial from touching anything and store the vial with the tip up inside a clean shot glass or other narrow container. Keeping this in the refrigerator will also minimize but not entirely prevent contamination. Okay, here's how to take an eye drop. First, tilt your head back as far as possible. Sometimes laying down makes this easiest. If you're right-handed, hold the eye drops in your right hand. Use your left hand to pull down your lower eyelid, which makes a pocket between your lower eyelid and eyeball. This is where you're aiming for the drop to fall. Rest your right wrist on the knuckles of your left hand. This gives your right hand better control and stability. Between the thumb and the index finger of the right hand, hold the bottle an inch or more above the pocket in the lower eyelid. Don't let the dropper tip touch your skin, the eyeball, or the inside of the eyelid. Squeeze out one drop and let it fall into this pocket. You can do the same maneuver for either eye. Putting the drop on the forehead or cheek doesn't count, but may happen when you're new to this. If you miss, try again, and you'll find you get pretty good at it after a few drops. If you absolutely can't do this, here's another way that's not quite as good, but almost as good. Look up towards the ceiling, or lie flat if you prefer, and keep your eye gently closed. Let the drop fall in the little valley between the inside corner of the closed eyelids. Then open your eyes and blink a few times. The drop will roll into the eye. This method is not quite as good because the drop comes in contact with your skin before going into the eye, giving an opportunity for the skin bacteria to contaminate the eye drops. Though it's not ideal, this method is generally better than not using your drops at all. By the way, there's never a reason to take any more than a single drop of an eye medication. The eyes don't hold any more than one drop, so taking any more is just wasting medication. Some people say they can't always feel when the drop gets in the eye. A good way to make this easier is to refrigerate the eye drops. You'll feel the cold on the eye. It's actually kind of soothing, and although it is not required to refrigerate most drops, it won't do any harm to keep them refrigerated. If you take drops that are stingy or irritating to the eye, it often helps reducing the sting a lot by keeping them as cold as possible. I hope you find this information makes taking eye drops easier. I'm Dr. Teymoorian, and thank you for watching.